Welcome to week 8. This is Group 5 presenting on practice foundations for critical thinking, reflection, and reasoning. Hi, this is Leticia, and I'm presenting from the unceded territories of the Tsimshian people from Terrace, BC.
Hello, class. My name is Alex. I am presenting the slides today from the traditional and unceded territory of the Latako Dene Nation, also known as Quesnel.
Hello, my name is Jaya Kyogen from the unceded territories of Tsuk Nation in Tsuk, BC. As a group, we'd like to gratefully acknowledge the nations where we live and thrive. We commit to humbly learn, actively listen, and respectfully support Indigenous peoples. We strive to create a safe and inclusive environment for all students, regardless of race, ethnicity, religion, culture, gender identity, sexual orientation, disability, neurodiversity, age, health status, and place of origin. So we'd also like to send our condolences and our thoughts to the Tumbler Ridge community as they're recovering from the recent tragedy that's gone on there. And a special thank you to our sponsor, Three Corners Health Service Society of the Shuswap community. We just want to thank them for their support in the project. Attached here are some of the considerations for our group agreement and the details that we used to work through the project together.
The learning activities for the week are 3 discussion topics, as well as an exciting midweek learning activity sponsored by the Three Corners Health Services. Make sure you stay tuned. For this week's learning objectives, please refer to the syllabus for week 8. Critical thinking is the ability to analyze information clearly and make sound logical decisions. It involves questioning assumptions, checking whether data is valid, and looking at problems from multiple angles. Strong critical thinkers use evidence to guide their choices and stay aware of how emotion and personal biases can influence judgment. These skills help us solve problems more effectively and make decisions that are thoughtful, informed, and grounded in reality. Critical thinking is essential in nursing because it helps nurse practitioners make rational, evidence-informed decisions. It strengthens patient safety, reduces diagnostic errors, and supports safe prescribing. Strong critical thinking also improves clinical outcomes and enhances interprofessional collaboration. It's the foundation for both clinical and diagnostic reasoning. As you reflect on your own practice, consider how your passion for a topic can shape your judgment. Self-reflective practice is an ongoing process where we can examine our experiences, thoughts, and actions to improve our nursing practice and provide culturally safe, equitable care. Through reflection, we identify strength, recognize areas for growth, and become more aware of personal biases that may influence our clinical judgment. Consider a time when you had a difficult interaction with a patient. What biases may have influenced your actions? And what might you change moving forward? Clinical reasoning is a core cognitive process in advanced nursing practice. It's patient specific and guides how we interpret information, make decisions, and deliver safe, effective care. As future MPs, our clinical reasoning strengthens through critical thinking, self reflection, and growing professional experience. As you think about this, recall a time when your patient's condition began to deteriorate. What signs did you notice first, and how did you prioritize your actions in response? Diagnostic reasoning is a key part of clinical reasoning and centers on identifying clinical diagnosis. It's an essential competency that separates MP from RM practice. As a future MP, strong diagnostic reasoning is critical for reducing diagnostic errors and improving patient outcomes. It involves gathering data, forming a clear problem, narrowing possibilities, interpreting tests, and arriving at a working diagnosis. You can see critical thinking gives us the analytical foundation. Clinical reasoning applies that thinking to patient situations. Diagnostic reasoning identifies the diagnosis as part of MP practice. Clinical judgment integrates all three to make safe, timely decisions. As you review the chart from Smith et al., notice how each process builds on the next and strengthens your development as an MP. Even though BCCNM doesn't list these skills as a standalone competencies, they are embedded through every domain. For example, the clinician role requires critical thinking and clinical reasoning for assessment, diagnosis, and management. CCNM doesn't label these skills in a scope document, but they are necessary for every aspect of MP practice. For example, self-reflection is essential, especially in areas like capacity assessments, mental health legislation, MAID. It's time to check your knowledge. Make sure you pause the presentation and click on the quiz. It's time to check your knowledge. Make sure you pause the presentation and click on the quiz.
I hope you all enjoy the quiz. Now let's practice some critical thinking. If you follow news articles, you probably noticed there have been some recent news articles featured transgender individuals involved in high-profile events in both Quebec and BC, unfortunately. What was your reaction? What did you say to yourself? Let's pause and think. I hope you all enjoy the quiz. Now let's practice some critical thinking. Now we're going to use one of the critical thinking strategies to guide us through the process. There are multiple strategies included in this week's course material. I encourage you to go through them all, but today please take a moment to follow the 8-step a problem a day strategy. Critical thinking and self-reflection helps us discover our hidden biases. It is important for us to recognize those biases. The list here contains some of the most common forms of biases. Please take time to learn about them and how not to fall into the trap. Be aware the list is not exhaustive. Transgender people continue to experience discrimination in healthcare, especially for transgender people of color. Discrimination comes from both biases and stigma. Biases are personal and often unconscious, while stigma can be structural, interpersonal, and individual. Stigma is more about disapproval, labeling, and devaluation. One prominent example of structured stigma is a pathologization of transgender experiences. Interpersonal stigma includes misgendering and dead naming. Misgendering is the repeated use of gender pronouns that are inconsistent with a person's current gender identity. Death naming refers to the use of a patient's legal or former name instead of their chosen preferred name. The best way to prevent stigma and reduce biases is to commit to critical thinking and self-reflection. As a clinician, we can act at least at the individual level to create an inclusive environment, foster gender sensitivity, recognize the experience of people living with multiple identities, engage with the community, and avoid pathologizing human experiences.
So these are some of the Indigenous considerations, given the vast amount of research out there that shows Canada's Indigenous peoples experience health inequities related to structural and social determinants. We thought this was an important part. So often in healthcare, we take a deficit approach where we describe a lack of something or identify failures and insufficiencies. So instead, over the next few slides, we're going to discuss actions and directions that were created using literature and the teachings of Indigenous elders from a strength-based lens. This is in hopes of shifting the narrative to a more positive approach. So these 8 interconnected actions include respecting Indigenous human rights, respecting their knowledge and health practices, recentering the power relationships, revitalizing culture and collective identity, cultivating individual and collective resilience, advancing equity, advancing self-determination, and capacity building with the individuals and the community. So again, using the teachings of Indigenous elders as well as literature, they've come up with 4 directions for strength-based actions in healthcare. The first direction is that strengths are gifts. So this is focusing on the positive attributes of Indigenous people. So to do this, we're going to find positive patterns, story, and evidence, understanding holistic health through Indigenous perspectives, and to value the Indigenous contributions. Direction 2 is to uphold relationality. So this is centering good relations with Indigenous people. Some of the ways we can do this is to disrupt racialized stereotypes, respect the principles of reconciliation by engaging in an ethical space, using respect and dignity to humanize interactions, and to honor the interconnections with all beings. So direction number 3 is to honor legacy. This is restoring Indigenous peoples' self-determination. Ways we can do this is by implementing UNDRIP, recognizing the contribution of elders and their role, respecting Indigenous ways of being, knowing, and doing, and meaningful collaboration and decolonization discourse. The 4th direction is to reconcile truth. This is addressing the structural determinants of health with Indigenous people. So ways to do this is to address the root cause of health inequity with constructive actions, understand the social and historical impact of health behaviors and outcomes, having Indigenous primary health care, ongoing co-learning through structural competency and cultural humility. Next is kind of putting everything together that you've learned so far. So I'm going to have you listen to the following scenario. A 32-year-old Indigenous woman comes to the clinic for a routine follow-up after a right wrist fracture. During the assessment of her arm, she states she intermittently experiences pain in her shoulder and up through her neck. You complete the limb assessment and the patient prepares to leave. As she's leaving, she passively mentions, "It's hard to come in here lately. I'm just so exhausted, and I'm short of breath just walking to my car." So with critical thinking, how do you clinically treat this patient? What assessments and tests are warranted? When you consider self-reflection, what are your initial thoughts regarding this patient? Does age, ethnicity, personal characteristics alter your thinking? Do you have previous experiences that change your thought process? When you consider clinical reasoning, what kind of decisions are you making regarding the patient's care needs? What is your level of concern for this patient? So now, I'd like you to just pause the presentation for a moment. You're just going to click on this short video here. It's only about a minute long. Watch it and then come on back to us and hit play. After everyone's had a minute to watch that clip, I'm going to ask you, are your responses the same? How did your thinking change? Would you clinically treat this patient the same? What assessments and tests would be warranted? What kind of decisions are you making for this patient's care needs? And now what's your level of concern? So this is just a small exercise just to show you that, just a little bit of a change in information can completely change your approach to a patient. So this is a good way to see how critical thinking, self-reflection, and clinical reasoning all mesh together to formulate your ideas. Okay, so I just want to thank you all for watching our presentation. We appreciate your time. We've added a few extra resources if you guys have the time to look through. They're really interesting. We've also added 3 discussion questions that follow on the presentation, but we'll also post them to Moodle. So we ask that you guys pick a discussion question to answer. And then we've got the references there. So again, thanks all for tuning in, and we hope you have a good week.